Good evening to all. The topic of presentation is addressing the diabetes mellitus with an innovative DAS plus DCB platform, the NV solution technology. So we all know that cardiovascular disease, especially in, it's a major cause of morbidity and mortality in diabetic patients. Especially the diabetic patients are the cause of death. 60% of the deaths in diabetic patients are due to cardiovascular death. And as we all know, India is a diabetic capital of the world, and by 2040, the 600 million patients are there in the world with diabetes. So why diabetes is having a different milieu compared to the non-diabetics? There are so many factors, especially the high increased, the coronary plaques are having increased necrotic core volume, increased inflammatory infiltrate, and increased calcification. So that resulting in small vessels, calcified vessels, and diffuse proliferative disease in small coronary arteries. That is the hallmark of the diabetic coronary artery. So what are the limitations of current DAS platform or current standard of care treatment in the management of coronary revascularization in the angioplasty? So because of the diabetic milieu, delayed vessel healing due to slow endothelialization and increased inflammatory response, that will be resulting in stent thrombosis or means various types of instant restenosis. So the today's topic of interest is NV solution technology. This is a technology that is drug-coated balloon on top of a DAS. Balloon is mounted on DAS. So DAS plus DCB platform, it carries drug on abdominal surface. The standard of care stents are carrying luminal as well as abdominal surface. But in this NV solution technology, the drug is being carried only on the abdominal surface, as well as because in addition to the abdominal surface, the balloon is also being homogeneously coated with the drug. And in addition to that, the balloon on the distal and proximal ends of the edges of the balloon, 0.5 millimeter, also being coated with the drug. So this is being called as a NV solution technology. And what is the advantage of this technology is that the abdominal coating may influence faster re-endothelialization. Because of in standard of care, the current second generation stents, because of the luminal thing, the re-endothelialization may be hampered. But in abdominal coating, the faster re-endothelialization will be there. So what are the differences with current DAS platforms in the NV solution technology? You can see the blue thing. So here the current stents DAS are crimping after the coating is being done, then only crimping. So the hampering of the drug delivery will be there. So but in this solution, NV solution technology, because of the DAP plus DAS, the pre-crimped coating is there. The balloon means stent and balloon is already crimped, then only coated. So there is a homogeneous distribution of the drug, and uniform coating layer is achieved as stent is prior mounted onto the balloon. And I have already said that dual side coating is there, or 360-degree coating is there with the current DAS platforms. But in this DAP plus DAS abdominal coating, so we have already discussed that point. And because of the homogeneous distribution, because of the drug plus balloon, there is more than 80% cover of the coronary artery intima. But in the current stent platforms, only 14 to 16% of the covering is there. So that is associated with the inappropriate drug exposure, especially in diabetes, where there is a small focal or diffuse proliferative diseases there. That is not enough. And this platform may address focal restenosis because of the same point. And because of the drug is being coated with the proximal and distal ends of the balloon, the edge restenosis is a thing of the past with the this DAP plus DAS platform. And what are the indications of this NV solution technology? So NV solution technology, because of the homogeneous distribution of the drug, it may improve results in diffuse disease in diabetics. Both the stent as well as the exposed parts of the balloon are coated with, which may help in treating the diffuse proliferative disease. That is not the case, that may not be the case with the current DAS platforms. And it may improve results in acute MI patients. Why? Just because of the drug is being coated in the balloon as well as in the abdominal part of the stent, it may act as a film, biodegradable film, and it may hold the debris from entering the systemic circulation. That way it can reduce distal embolization, that way decrease in slow flow or no reflow. So what are the evidence base so far with the DES plus DEP platform? So there's an Indian registry, it is called Enable Registry, that is by Samir Dani et al. So it's a 31 center study. I think it's a sicker set of population. Around 30%, 34% of the population are diabetic, around 60% is acute coronary syndromes, 40% is hypertensive, around long lesions are around 55%. Percentage, small vessel disease is 47%. The result states that the MACE, you can see that the MACE and everything is, I think, MACE at the end of 3 years, the last 3-year follow-up has been published in the, means presented in the DCT this year, 2021. So the MACE, you can see the first year it is 2.9 and 3.6% is the MACE with a 3-year follow-up. That's a very good, especially in a all-comer population with 30% of the diabetic population, and it's a much sicker population. And you can see the, in complex subgroups like diabetic subgroup, it is 5.3%. ACS or AMI group, it is 3.4%. Small vessel group, it is 4.6%. So long-term clinical outcomes revealed lower MACE rates in the overall population as well as in complex subgroups. The results clinically prove the safety and efficacy of novel abluminal DCB plus DES in a real-world population. So this is one of the largest multicentric randomized control trial study in diabetic population. It is called Ability Diabetes Mellitus Global Studies. It is by Roxana Meharan and all. So here it is 3,000 patients, 1,500 patients with abluminous, DES plus and sirolimus eluting stent versus everolimus eluting stent, that is 1,500 patients. The primary endpoint is target lesion failure and ischemia-driven target lesion revascularization at 1-year follow-up. The first patient enrolled in June 2020, and I think the trial recruitment has ended in the month of July, and it is going to be presented in the next EuroPCR. So what are the take-home messages from this presentation? Despite optimal medical therapy, patients with diabetes mellitus remain at high risk of ischemic events after coronary revascularization with newer generation DES. Envisolution DCB plus DES, which has unique coating technology on both the abluminal surface of the stent as well as on exposed parts of the balloon, may be a valuable option in patients with diabetes mellitus. Ongoing studies will provide further evidence on the success of this technology and its impact on the prognosis of diabetic patients undergoing PCI. Thank you all for the attention.